very tight ligaments here. So only with some extension I can feel a C2, okay? Then I go down to C3, which is quite prominent on her. Hold her like that.
Držíme to takto.
And now what I'm going to do is I'm starting from the left, rotate. I am rotating her passively until the C3 wants to move. It means I'm bringing some stress on C2-3, down to C2-3. It starts for 1-2, goes to 2-3.
Čiže pasívne rotujeme jej hlavu doľava a snažíme sa ako dostať ako keby ten nátlak na C2, C3, pretože ten nátlak prichádza z C1 na C2, ale potrebujeme ho dostať hlbšie na C2, C3.
So I'm rotating until it comes to my fingers.
Čiže rotujem, až kým to príde k mojim prstom.
Lateral flexing until it comes to my fingers.
Nakloníme to doprava, kým to príde k prstom.
How do you feel?
Ako
Any
sa...
pain?
No.
Spýtame sa, či pacient cíti bolesť.
Extending until it comes to my finger.
Natiahneme, kým to nepríde k prstom.
What do you feel?
Pain on the right side.
Pain on the right side.
Cíti bolesť na pravej
Familiar?
strane.
No.
But on the right is not what I'm stressing now at the moment. I'm not compressing the right. And at the end, I'm adding some approximation of 5-6 kilograms from my axilla and ask her, what do you feel now?
Čiže pridáme tak 5-6 kg záťaž na jej hlavu.
Anything similar, familiar? Where are your headaches usually? Left or right? Right. Okay, so this is not surprising. That was her reference, okay?
Čiže nie je prekvapujúce, že cíti bolesť na pravej strane, pretože väčšinou ju bolí hlava na pravej strane.
Okay, going now to C3 on her, same thing, but this time with my left hand.
Presunieme sa na C3, rovnaká vec iba na druhej strane.
Rotating, she has much less rotation to this side.
Točíme, na túto stranu má oveľa menej rotácie.
Lateral flexing, she has much less.
A taktiež aj na toho laterálneho
Extending, she has much less. What do you feel now?
It's starting to numb.
Is that your familiar pain?
Yes.
Okay.
Má
Got it.
oveľa menej rozsahu na
Start
túto
to
stranu.
provoke. No need for, and what you can do after, you can do a little bit of distraction, just to help her to relax a little bit. Desensitize it. Do you feel it now better?
Yep.
So just take the head up. Usually nociceptor is like the switch, yeah? It's like turn it off, turn it on. It's like that. But if you stay too much with the pain, then it starts, the whole room starts to get light, yeah?
Čiže na konci musíte zdvihnúť jej hlavu, aby ste jej pomohli uvoľniť tú bolesť, pretože tie nociceptory, ktoré má, sú ako ten vypínač, že môžete to zapnúť a vypnúť, ale keď ostanete príliš dlho na tom zapnutom, tak je potom ťažké ako keby sa zbaviť tej bolesti, preto musíte prestať čas.
Okay, is that clear?
Rozumiete?
This test. This was scenario for patient without present headache. I got the answer C2-3 much stiffer and provoking familiar pain on the right. It means this is for me now, okay, C2-3 is really suspected to be one of her main problems, like in most of the cervicogenic patients.
Čiže teraz sme v podstate prišli na to, že v tom C20 na pravej strane je to oveľa bolestivejšie pre ňu a toto je segment, ktorý je veľmi častý pre pacientov cervikogénnych bolestí hlavy.
The last thing we need to do for C2-3, so C2-3 is important to understand, is not complicated segment.
C2-3 nie je komplikovaný segment.
Because it's quite simple, similar to other segments of the neck, but is the most involved segment in cervicogenic headache. Okay. So it is clear, it should be cut and clear if it's there or not. It's not very hard to assess this segment, but you need to remember to do it.
Tento segment je celkom problematický, pretože je veľmi zapojený do nášho každodenného pohybu a to vyhodnotenie tej bolesti, či tam je alebo nie, by malo byť veľmi jasné a nie je to príliš ťažké diagnostikovať.
Occiput 1 and 1-2 are more complicated with all the sophisticated techniques to combine the movement, and then also there's much more mobility, so you need to be able to assess it better. Here, immediately understand stiff, not stiff. Very clear.
Occiput 1 a 1-2 sú oveľa...
Pain, not pain, right versus left, easier, simple to assess.
Čiže occiput 1 a 1-2 sú oveľa komplikovanejšie na vyhodnotenie, pretože tam je oveľa viac rotácie, oveľa viac unikátnej štruktúry, ale to C2, C3 by to malo byť celkom jasné na diagnózu, či je to napravo, naľavo, stuhnuté, nestuhnuté, bolestivé, nebolestivé.
Now, what we also see with 2-3 is in palpation, there is a kind of a typical presentation of position 2 in relation to 3. So there is a typical position fault, we call it. A positional fault that is typical to patients with cervicogenic headache. I will explain it, and we are searching for it in palpation.
Čiže pri segmente C23 je veľmi typická pozícia, ktorá nastáva pri pacientoch s cervikogénnymi bolestiami hlavy, že teda sú v podstate takto položené C2 na tom C3.
And what is the typical position?
Čo je typická pozícia tých pacientov?
Should we find, so this is my 2, you look from the back, yeah? This is
Pozerajte sa
C2,
zozadu, C2.
and this is 3.
C3.
Usually, who should be longer dorsally?
Ktorý by mal byť
Should be more prominent. Look at Johnny.
Ktorý stavec by mal byť výraznejší zozadu.
Okay, which one should be more dorsal? 2 or 3?
Ktorý by mal byť vystuplejší.
You say 2? No? Why 3? From the back,
Zozadu.
who is more dorsal? Who is more back? Of course 2.
2.
2 is the longest spinous process. So it should be, 2 should be much longer dorsally than 3.
Že 2 by mal byť oveľa vystuplejší vzadu ako 3.
But if the patient has a forward head posture,
Ale ak pacient má takýto postoj s hlavou naklonenou dopredu,
then the 2 comes slowly even with the 3.
ten C2 už sa vyrovnáva s C3.
That's what happens to most cervicogenic patients.
Toto sa deje.
This is what happens to Michal. When I palpate her, when I try to find 2 or 3, I don't know, is that 2, is that 3, because they are not different enough. They are like that, they are like together.
Toto sa deje väčšine pacientov a toto sa stalo aj Michal, keď je to tam.
So this is one thing to find, if it's like it should be,
Toto je jedna vec, na ktorú musíte hľadať.
dorsal 2 on 3, or is it more even, or sometimes even 3 will be more prominent, which is very bad.
Čiže toto je vec, ktorú musíte hľadať. Ktorý stavec je prominentnejší, malo by byť 2. Ak sú zarovno, je to zlé. Ak je 3 prominentnejší, je to veľmi zlé.
And what do you think, if Johnny has a left headache,
Ak si myslíte, že Johnnyho boli ľavá strana
and
hlavy,
I'm looking from the frontal plane, the position of the spinous of 2.
hľadáme,
Compared to 3.
pozeráme sa spredu,
3 is the foundation of the neck. What do you think? 2 will tend to be more rotated to the headache or away from the headache? What do you
myslíte,
think?
že druhý stavec bude natočený skôr k bolesti hlavy, alebo od tej
This,
bolesti
like
hlavy?
this, or like that? What do you think?
Ak ho boli
The
ľavá
headache
strana.
is on his left. The muscles on the left will be tighter or looser?
Budú tie svaly
The muscles
uvoľnenejšie
of
alebo
the left.
napätejšie na ľavej strane?
Tighter, and
Napätejšie.
usually they will take the spinous to their same side.
A zoberú ten stavec so sebou na rovnakú stranu.
So usually we find, this is from clinical experience,
Čiže toto je z klinickej
based on other
skúsenosti.
clinicians like Dean Watson, like other clinicians, you will find the cervicogenic headache patient, first of all, in the sagittal plane, more slipped anteriorly with C2 and 3. So it means that 2 will not be dorsal enough. And secondly, the 2 will tend to be a little bit shifted to the headache side compared to the 3.
Čiže pri pacientoch s cervikogenickými bolestiami hlavy nájdeme väčšinou to, že ten druhý stavec bude bližšie, nebude taký prominentný, nebude siahať za ten tretí stavec, ale bude naklonený smerom dopredu. A taktiež je pravdepodobné, že bude trošička vyklonený do strany, na ktorej zažívame tú bolesť.
Now it's hard to assess 2 compared to 3. Then what you can do is to see compared to the protuberance, occipital protuberance, that's the midline more or less, is that more to the left or to the right compared to the midline of protuberance. If it's hard for you to compare 2 and 3, that can be a better alignment.
Ak chceme teda vyhodnotiť, či je to naozaj po tej stredovej línii, tak môžeme použiť ten occipital protuberance, ktorý by mal byť v strede, pretože z C3 je to ťažké porovnať a porovnáme to práve, ten C2 porovnáme práve s tou líniou occipital protuberance až po C3.
So when I palpate,
Takže keď hmatáme,
that will be exactly what I'm looking for.
to je presne to, čo
And that will
hľadáme.
be the finalizing the assessment for 2-3.
A toto bude v podstate ukončenie nášho vyhodnotenia pre C23.
One more thing will be after, so almost the last thing for 2-3.
Toto je takmer posledná vec, ešte budeme mať jednu vec.
So this is 2 and this is 3. You can feel on Michal a very good example of even 2-3. I cannot say who is more dorsal. It should not be like that.
Na Michal môže vidieť veľmi dobrý
should not be
príklad
like
toho, že C2 a C3 sú zarovno. To by nemalo byť takto.
Of course, if someone with no headache, you find it, then okay, it shouldn't be, but he has no problems, then you can't say there is a problem. But if you have headaches, that's a sign for you that you should be fixed somehow with your positional fault.
Ak to nájdeme na pacientovi, ktorý to má síce zarovno, ale neprežíva žiadne bolesti hlavy, tak nie je to síce ideálne, ale nemusíme s tým nič robiť. Ale ak je to pacient, ktorý prežíva bolesti hlavy, tak je to porucha, ktorú musíme liečiť.
Okay, vožela po mi svolujeme.
Amen.
And on her, when I take her, when I try to find the spinous of 2, see, it's not in the middle. This is the middle. That's her protuberance, so that will be her midline. But her spinous of 2 is shifted to the right, exactly like I would expect with a cervicogenic presentation. So she's also shifted, and she's presenting for us a classical scenario of positional fault of C2 on 3.
Čiže jej C2 je naklonený na pravú stranu, kde zažíva bolesti hlavy, čo nie je prekvapivé po tomto, ako sme urobili tento test. A ona je typický príklad, kedy ten C2 nie je tam, kde má byť, na C3.
And another thing that we usually find on and interesting for us for 2 on 3 is the PA of the 3. What do you think, will be stiff or not stiff on cervicogenic headache?
Čiže ďalšia zaujímavá vec, ktorú väčšinou nájdeme, je PA na C23.
So think about that. If the C2 slide anteriorly, then it will be very stiff compared to the 3.
Tak to bude veľmi stuhnuté v porovnaní s C3.
So because doing PA on C3 is like retracting C2 on 3.
Čiže keď robíme PA na C3, ako vrátime ten C2 na pôvodné miesto za C3.
And that's exactly what we need to do with most of them, because they are stuck like that, and we want to fix them, because we can't pull C2. C2 slide like that. How can you bring it back with manual therapy? You don't have anywhere to hold. But what you can do is to compress C3.
Čiže musíme zatlačiť na C3.
That will be a nice correction for the mobility. And that's exactly what I'm testing now. If the C3 of Michal is tight and I'm compressing the centrals, I'm assessing it pure central, a little bit inclination from the right, a little bit inclination from the left, and usually what we find, it will be tighter when it's inclined from the side of headache towards the opposite side, exactly what we see on her. She's a textbook for cervicogenic headache.
Ona je typický knižný príklad, učebnicový príklad cervikogenickej bolesti hlavy.
When I go like this, that's her most stiffness. And usually, if we want to fix it, we want to improve her mobility, we better go from the most stiffest dimension.
Keď chceme zlepšiť jej mobilitu, tak musíme ísť zo smeru, kde je to najviac stuhnuté, čo je v tomto smere, ktorý vám ukazoval.
But when I compress here, sometimes it's too painful for patients.
Niekedy je to veľmi
Is it painful?
pre pacientov.
Sometimes it's painful. Then we can use some distraction physical and distraction mental, with mobilization over the T4 while we are mobilizing the C3, and that usually will put less pain. See here it's not moving, but when I do it together, she's moving much more on her C3 PA, inclined PA.
Čiže musíme použiť niečo na odvedenie pozornosti. Je to tento pohyb, ktorý robí. Je to na odvedenie pozornosti aj z fyzickej bolesti, ale taktiež aj toho mentálneho. A v podstate pri tom sa hýbe oveľa viac, ale je to pre ňu menej bolestivé.
This bad?
Yeah.
Okay, so I can really mobilize to improve mobility. I can also sustain it with some force while shaking a little bit from the thorax.
Čiže môžeme to taktiež
Walking, yeah.
spevniť silou pri tom, ako sa to trošička hýbeme zo strany na stranu.
And that tends to really soften the PA on the C3.
Toto väčšinou úplne uvoľní to PA na C3.
Yeah, it's a different story now. Starting to get a better mobility.
Teraz už má lepšiu mobilitu.
And when we fix that,
A keď napravíme toto,
many times what happens is that C2 starts to get more into the middle, into the midline.
tak C2 sa
Clinically,
posúva viac
yes.
do tej centrálnej línie.
So we start to see, instead of trying to bring it back from itself, many times when you treat the 2-3 and ease it, you get less stiffness, then C2 slowly, maybe less nociception there, and slowly you start to see C2 fixed.
Are you pressing exactly on C3?
Yeah,
Mm-hmm.
but with inclination.
Mm-hmm.
But with inclination, I look for the most stiffest component. She's much better now. That's it. Now she has a mobility.
Že tlačíme priamo na C3, ale s tým, že sa nakloníme na to.
Most of academic patients, they need it at one stage of the treatment. They need this treatment.
Väčšina
Because most of them
cervikogénických
are
pacientov
stiff.
potrebuje túto liečbu aspoň raz počas fázy ich liečenia.
And what can be the reassessment for her after?
Čo môže byť to prehodnotenie pre jej stav?
Could be flexion rotation test, but to what we did now could be the mobility of the segment to block C3 and see if we have improved something on her mobility. Let's see.
Môžeme
Let's see
urobiť
that.
ten test, ktorý sme robili pred chvíľou,